May, County Commissioner for District 3. I'm here today with May's Message. Today I'm here with Dr. Greer Hall, who's been with me the last 2+ months, talking about COVID-19, coronavirus, safe practices. Welcome, Dr. Greer Hall.
Thank you, Commissioner May. So good to be here.
It's good to have you, and I know that you've been right by my side on May's Message for the last couple months, and the governor has taken down some of the barriers and restrictions, and you're gonna not be in as much telemedicine as actual going back in, and so we know that this will be probably one of the last times we'll be able to give out the information on a weekly basis. Although I hope that on a monthly or some other routine that we'll be able to get together. But anyway, welcome. And why don't you just give us an overview of where we've been, where we come from, and where you see us going?
Okay, well, it has been my distinct pleasure to join you each week these past 2 months to help educate and inform the Pensacola community about this deadly virus. A lot has certainly changed since we did the very first May's Message on COVID-19 at Brownsville Test Site. Then there were about 1,000 deaths nationwide. Now we have 100,000 deaths nationwide from COVID 19. And this number is expected to increase. Then we did not think it was necessary for the general public to wear face masks. Remember, we found that out. Now we know this is necessary to stop the spread of COVID 19, especially in those who have COVID 19 but do not have symptoms, which is about 30% of all cases. Then we thought it was just a respiratory infection. Now we know there are patients who present with a stomach virus, fatigue, sore throat, headache, and even a multi-system inflammatory disease seen in children. Then there were those in the community who looked like us who thought this virus could not affect them. Now we know that African Americans are at a much higher risk of complications and death as a result of COVID 19 due to health and socioeconomic disparities and chronic conditions such as asthma, high blood pressure, heart disease, obesity that disproportionately affects us. And then we did not know much about the virus in terms of how virulent and contagious it could be. Now we do with 1.7 million cases nationwide, up from the 70,000 cases at the end of March when we first started meeting. And then we thought it was only the elderly population that would be at risk for the complications from COVID 19. Now we know it's not just the elderly. Yes, they make up 80% of the deaths, but there are many healthy young adults who make up the other 20% of the deaths. We now know that those in close living quarters, such as assisted living facilities, nursing homes, and correctional institutions, are also very vulnerable to this virus. And we have learned the power of organizations like Community Health Northwest Florida, Sacred Heart Hospital, and Escambia County collaborating to work towards the common goal of fighting COVID 19. So we've learned a lot these past 2 months, and I'm sure there's more to learn.
Well, it's amazing, Dr. Greer Hall, that when we first started, you and I both were very concerned about pockets of poverty, the underserved neighborhoods, and we thought 1,000 deaths causes alarm, and today we have 100,000. I mean, but I think because of your efforts and a lot of the efforts that we were doing here in Escambia County, that we were able to somewhat mitigate. I mean, we don't look as bad as Mobile or New
Right.
Orleans. Our friends in Montgomery, Alabama, our friends in Birmingham, I mean, they're having a lot of deaths and a lot of positives.
Mhm.
And one of the great things we did with your help in community health and Sandra Donaldson, Sandra Smiley, is we did this mobile testing. And I think that I know we've gone to every part of my district and almost every part of this community and every part of this county in getting those services there. So thank you for that.
You're welcome, and thank you so much for being a part of this collaboration because we needed that in order to accomplish this. So we appreciate you stepping out as well.
Well, we appreciate that. And as the governor has lifted the barriers, I know a lot of people are trying to get back to their normal way of life. And so, there have been some restrictions that have been lifted in youth activities, summer camps, athletics. And, I'm a big athletic guy, a big summer camp. I mean, one of the great programs we have here is our summer employment program that we're kicking off here on June 8th. And our summer program at Evanwood and Brownsville. We're kicking, but can you give us some medical recommendations and some of the protocols that not only the camps that we run, but camps throughout all of Escambia County should be adhering to?
I agree with those measures that are being taken with asking those who, if there are bleachers present, to sit further apart, spreading out your lawn chairs, not sharing drinks and not sharing the same coolers. Those are very good measures that I know are being taken with some of the athletic programs. And so we do agree with these. But in addition, we also recommend that parents, summer camps, athletic organizations, also implementing and following the CDC guidelines recently put in place to protect the children and those who work at these facilities from COVID-19. These strategies include using personal protective measures such as your face coverings and good hand hygiene, practicing social distancing, cleaning and disinfecting surfaces frequently. Some camps will also take measures such as daily health screenings and or temperature checks on all the campers each day. And they've also reduced the number of campers that are going to be allowed to allow for social distancing. And I highly, highly recommend that these measures be taken along with the CDC strategies that are already in place. And we know our children can't stay cooped up in the house for the entire summer. We know this, and we want them to be able to get out and to enjoy themselves, but we want to make sure that they're safe and they're healthy when they do so. If you're going to send your child to a summer camp, just make sure that the necessary precautions have been put in place, and make sure that these, whatever summer camp you're going to be sending your child to, that these measures have been implemented to protect the campers there. And if your child is old enough, also explain the importance of following these measures to your child if they're old enough to comprehend it.
Yep, that's some of the things that we're doing right here. We're gonna take temperatures, sanitize, having the children come in. I encourage parents to be patient. One of the things that we're working on is a robust scholarship program because we know everyone's been hit hard by COVID-19, but we're gonna have to limit our numbers, I think, till about 36 kids per camp because we want to practice the social distancing and keep in groups 10 or less, and that means with the campers and the teachers and the assistants. So we're only going to be able to put about 7 or 8 kids per group. So we're going to do that. I encourage people to stop by the Evanwood Community Center or the Brownsville Community Center. That information will be coming out for the camp because, like you said, we want to make sure that we get children in good and safe environments. And that's the most important thing that we can do.
I agree.
But Dr. Greer, again, this is, I've known you my entire life, and yeah, I actually was with Robert Greer on yesterday and seeing the great work that the Greer family, from the H&O restaurant to the Grand Hotel to the many things that your family has given. And I mean, look, one generation later, look what God is doing in your life and what He's doing in my life, allowing for us to give back to a community that our parents and grandparents, quite frankly, were staples and leaders in, and they passed it on. And that's what it's really about, paying it forward. You have paid it forward these last 2.5 months, and I know you will continue to pay it forward. I'll tell you how many young people that are in my program that say, "Oh, you know Dr. Greer Hall? She my daughter." And you are inspiring a generation of not only African-American young ladies, but young ladies all across the globe, seeing the great work that you're doing in pediatrics. So again, we thank you. And in closing, May's message, the directions, or is there any updates with Dr. Greer Hall or community health that you want to leave us with?
Yes, community health, we're continuing to test for COVID-19 and targeted underserved communities in Escambia and Santa Rosa County. We'll be testing at Sunrise Apartments on Fairfield Drive this Friday for walk-up testing from 9 to 12 or while test supplies last. Organization-wide, we have tested 2,847 people for COVID-19, with 83 of those being positive to date. We'll continue to promote our Wait Don't Congregate message that encourages our citizens to continue to avoid large gatherings during the pandemic, not only to our local pastors and churches, but to the community as a whole by partnerships formed with the Escambia County Medical Society and Baptist Hospital. And speaking of local churches, the CDC just recently released some very good specific guidelines for churches to follow if they're going to be opening up and resuming live services. So we do recommend every pastor every church, every faith-based organization to refer to these guidelines to help decrease the spread of COVID-19 in your congregation. And I want to urge everyone to continue to take this virus very seriously. As orders get lifted and beaches and businesses reopen, I encourage everyone to do the following: cover your face, wear your face mask when you're out in public to protect those around you from catching the virus from you. Keep your hands clean, wash them often, keep them sanitized, and don't touch your face. Maintain your space. Stay 6 feet apart when out in public and do activities outside when possible. And wait, don't congregate. Avoid those gatherings of more than 10 people at all times. The virus can spread like wildfire in social gatherings. We know this to be true. So we know there'll be more cases of COVID-19 and many more deaths in the months to come. And this upcoming fall and winter may be one of the worst yet. So unfortunately, this virus is not going away anytime soon. And until we have a vaccine or a medication that is proven to work, we must all take these necessary precautions to mitigate the spread of COVID-19 and seek medical attention and get tested if you have symptoms of COVID-19 or if you've had close contact with someone with COVID-19. Also, see your doctor for your other health conditions and routine physicals and well checkups and immunizations for the children, because we're here for you, whether it's through a telehealth visit or in person. We are here for our patients. And I do believe knowledge is truly power. And I pray that the knowledge that we were able to share these past 2 months will empower and encourage everyone during these unprecedented times. And thank you for having me, for your steadfast leadership in the community. I cannot thank you enough. And if there's anything you need in the future, please call on me.
Thank you, Dr. Now I agree with you. Wait, don't congregate. This virus is still serious. We've had 3 positives today. And so I also say to all of my friends and family, it doesn't matter if they open up the White House, the governor's house. We have to use the God-given ability to discern what's good and what's right for each individual. And so please wait, don't congregate. Thank you, Dr. Greer Hall. Thank each of you for joining May's Message. Again, it's been a journey, and we're not out of the woods yet, but together we can make it.